Secondly, may I ask that all completed paper evaluation forms are deposited in the drop box that my colleague is holding up right now. Thank you. Okay, it is now time for the resumption of item 6 of the agenda, Policy Priorities for Improving CRVS in Asia and the Pacific, and I am pleased to hand over proceedings to the Chair, His Excellency Mr. Mustafa Kamal.
Thank you, sir. Good morning again, ladies and gentlemen. We are a little bit late and delayed as well. So it was precisely because of me. I'm sorry, because very bad traffic. And in our country, if you had the experience of visiting Bangladesh, you will see the traffic never moves, you know. Always it is standstill. However, Thailand traffic also sometimes is very unpredictable. However, let us come back to our main agenda for today. First of all, we shall be listening His Excellency Mr. San Luin. He is a Deputy Minister from Myanmar. Thank you, Mr. Luin.
Honorable Chairperson, Excellencies, distinguished delegates, ladies and gentlemen, good morning, Minglaba. First of all, I'd like to express that on behalf of Myanmar delegation, I wish to congratulate the Commission for organizing this informative conference on CRVS. Mr. Chair, civil registration provides people with documentary evidence to secure recognition of their legal identity. Because of it, individuals can be accessible to essential services such as healthcare, education, and so on. In addition, it enables an individual to enjoy certain rights such as political participation, property ownership, and etc. Vital statistics are generated from civil registration. The vital statistics such as timely and accurate population estimates, other demographic statistics, health statistics are basic requirements for effective policy making in inclusive and sustainable development. So, CRVS plays an important role not only for individuals but also for the society. So, Myanmar would like to say that we are in favor of ministerial declaration and regional action framework for CRVS. Chairman, the registration of births and deaths in Myanmar started in 1907. The system was gradually improved year after year in order to reach all the areas to register the vital events. According to Multiple Indicator Cluster Survey, MICS 2010, the birth registration coverage reached up to 72%. However, there is a big difference between urban and rural. 93.5% in urban, but 63.5% in rural. So, the government of Myanmar took significant steps to improve the vital registration. There are outstanding developments in 2014. First, the coordination committees on birth and death registrations were formed at the national level, state and regional level, district level, township level, and ward and village tract levels. National level committee is led by Deputy Minister for Ministry of Immigration and Population. Second, the forum on birth registration was held in July 2014 to enhance public engagement and participation. This event contributed towards increasing coverage of vital registration. But the birth registration week was conducted during 20 to 24 October in 2014 in 2 states and 1 region to enhance the awareness of community on the importance of voter registration. In addition, with the support of UNICEF and European Union, an electronic platform will be installed in 44 townships before the end of 2014 to demonstrate the effectiveness of permanent recording of birth. Despite these promising initiatives, Myanmar is now facing a number of challenges in order to attain the desired level of coverage. The most severe challenge is that we do not still have a legal framework for CRVS. Moreover, there are other significant challenges. They are: 1, inequitable access to services within the country; 2, lack of linkage between birth registration and public services such as immunization; 3, lack of community awareness on the importance of birth and death registration; 4, capacity limitation of the personnel concerned; and finally, limited resources in planning and implementing CRVS. Although Myanmar is in such a difficult situation, we are committed to improving our national CRVS. The formation of the Coordination Committee on Birth and Death Registration is the proof of Myanmar government's political commitment and its firm determination. At present, Myanmar government is working closely with UNICEF in this respect, and we would like to collaborate with other development partners. In addition, Myanmar government would like to invite the donor community to participate in Myanmar's CRVS. In conclusion, we are fully confident that with this continuing initiative of the Commission to strengthen CRVS, I believe that the dream "Get everyone in the picture" will come into existence within the set time frame. Thank you.
Thank you, Your Excellency. And the statement from Myanmar, what you understand, although they are facing some challenges in the delivery of the CRVS, but even then on the whole, the statement we heard from them is very, very encouraging. Thank you, Your Excellency. Now, we shall move on to Islamic Republic of Iran, and Dr. Nazim will be talking to us. Thank you.
In the name of God, Mr. Chairman, honorable ministers, distinguished delegates, ladies and gentlemen, Islamic Republic of Iran seeks this opportunity of naming the decade 2015 to 2024 as the decade of civil status registration, and it hopes that in that decade we could witness valuable achievements and accomplishments in the civil status and biostatistics. Due to believing in the importance of the civil registration, Iran has already dedicated a name in its national calendar as National Day for Civil Registration. In the recent years, in fact, civil status registry in Iran in its today form goes back to 1918, when the task was first started. So far, more than 78 million Iranian population have already received identity services. 70% of this population lives in the cities, and 71% of that population is in young and middle-aged groups. Dear colleagues, the civil registration of Iran follows three main missions under the topics of registry of civil status, issuance of identity documents, and population and releasing population statistics and information. On the registry of the civil status, extensive infrastructure have been established in the country to provide the citizen with necessary services with more feasibility in base core form. Providing those infrastructures included the registry of about 98% of birth events during the legal 15 days deadlines and about 97% of the death events within the legal 10 days deadlines. By using the capacities of legal entities and the national person under the title of registry assistance that includes more than 40,000 members that move in the districts for the registry of vital status and events in far-off spots. In the issuance of identity documents, it should be mentioned that documents and certificates are issued for all Iranians after the registry of birth or death events. A birth certificate issued for each newborn under web services by using the central database, in addition to the mechanized birth certification, a smart national ID card is issued for each person in the society to replace national ID card. National Smart ID card as a key to step into e-government by using biometric data such as fingerprint, digital signature, and citizenship emails have created grounds to identify individual in virtual space and increase services. In the area of producing and releasing population statistics and information too, due to increase in the quality of the statistics of vital events which are developed through registering identity data. Those statistics too are constantly used by the state planners and policy makers. Benefiting from the experiences obtained from holding 2 international meetings in the civil registration with the participation of the Economic Cooperation Organization ECO and the Organization of Islamic Cooperation OIC, the Islamic Republic of Iran, in line with the realization of the regional perspective of ESCAP, is prepared to render any cooperation, collaboration, and interactions with the region countries. For this purpose, Islamic Republic of Iran, expressing its support of Clause OP8 of the draft of the Ministerial Declaration on the Cooperation of Regional and Sub-regional Organizations for expansion or cooperation in the world, Iran suggests to establish an international organization in the civil registration under the support and structure of the United Nations. I appreciate and thank the arrangers of this meeting. With this term, get everyone in the picture by emphasizing on the importance and innovation in the development and presenting the closing declaration. And I thank you for your attention.
Dr. Najimi, your statement simply inspiring. It inspired us, and hopefully all will be induced to move forward. Thank you, sir. Now it is the time for Mr. Subedi, Dr. Subedi from Nepal.
Honorable Chair, Excellencies, distinguished delegates, ladies and gentlemen. At the outset, on behalf of my delegation and on my own, I would like to extend sincere congratulations to you, Mr. Chairperson, on your election to the chair of this important ministerial conference. I am confident that under your able leadership, we would be able to bring the conference to a successful conclusion. This is a very important event that member countries of ESCAP are present here to show their commitments for the achievement of the common goal of universal registration to ensure identity rights of each and every individual. This is a basic and a very technical task which not only demands a well-functioning system of legal framework, registration, documentation, reporting and analyzing for evidence-based planning, but also a comprehensive level of frontline coordination among different agencies and stakeholders with their capacities built in. In this context, I am honored to share our experiences, achievements, challenges and perspectives. Mr. Chair, Nepal started vital registration 37 years ago by assigning responsibilities to local bodies. We started identifying citizens through citizenship since early 1950s. However, we experienced that the scope of identification through vital registration system is wider as it also covers non-citizens. In line with this wider scope, Nepal has established local registrars offices at local bodies as closer to the people. We have emphasized on wider range of coverage through social mobilization and empowering the communities through ward citizen forums and citizen awareness centers. My delegation is confident that strengthening local governance can institutionalize government's initiatives as well as enhancing people's participation. Mr. Chair, Nepal has recently established Central Department of Vital Registration, which will improve CRVS and increase the efficiency on the universal social cash transfer management. Nepal is piloting the software-based vital registration. Furthermore, Nepal is launching an online registration system being implemented in all 130 municipalities by the end of this fiscal year. Nepal is also planning to run 1,000 online registration centers targeting the whole country in coming 5 years, and surveys on CRVS has been initiated, which will produce baseline for 2015. Based on this baseline, we will be able to set the targets on an early basis so as to achieve the goal of regional action framework. Nevertheless, until and unless we strengthen frontline with skilled human resources and basic logistics, no system can work efficiently. Consequently, we are committed to strengthen the capacity of frontline service centers. The Ministries of Federal Affairs and Local Development and Health and Population have been collaborating for interagency cooperation at local level. We are confident that our CRVS system will contribute to the well-functioning of the national ID system. With all these initiatives, we want to stand along with the rest of the Asia and the Pacific region. Nonetheless, we are not free from challenges. Scattered demographics along the hills and mountains, weak infrastructure and connectivity, and limited human resources are the impediments against the smooth functioning of the CRVS. Furthermore, making birth registration mandatory to the services has a risk of trade-offs between registration and utilization of basic services like immunization and primary school enrollment. Above all, it has been a critical challenge for us to incentivize vital registration to the general people. Mr. Chair, Nepal is practicing different pragmatic models of local governance, including mobilization model. Our design was based on generalized and one-size-fits-all. Now, we need to adopt an asymmetric model of decentralization with adequate capacity to carry out assigned responsibilities, including vital registration. Since CRVS is our priority sector, the government of Nepal will definitely invest for improvement of services. Against this backdrop, my delegation invites development partners and civil society to come hand in hand to improve local governance and the CRVS in particular for getting everyone into the picture. Thank you for your kind attention.
Thank you, Dr. Subedi. Now it is time for Armenia. Mr. Agram will speak to us from Armenia.
Уважаемый господин председатель, уважаемые представители стран, дамы и господа, Республика Армения выражает глубокую признательность всем организаторам, соорганизаторам, которые содействовали работе по организации и проведению конференции. Разрешите представить ключевые аспекты, а также задачи в сфере политики и реформ регистрации актов гражданского состояния и естественного движения населения. Улучшение и совершенствование системы регистрации актов гражданского состояния и естественного движения населения является приоритетом правительства Армении, так как для охраны и укрепления здоровья населения и улучшения демографической ситуации важно знать, какая рождаемость, как она регистрируется, естественный прирост населения, а также показатели и причины смертности. Для того, чтобы ценить каждую жизнь, необходимо вести учет всех людей и отслеживать все случаи рождения и смерти, которые возможны только с помощью усовершенствования и улучшения деятельности системы регистрации актов гражданского состояния. Регистрация актов гражданского состояния регулируется законом РА об актах гражданского состояния и на основании этого принятых других подзаконных актов. В указанном законе, начиная с 2005 года, то есть с момента вступления закона в силу, были произведены многочисленные изменения и дополнения, направленные на улучшение и упрощение процедуральных норм в области регистрации актов. Закон о государственной статистике Республики Армения устанавливает порядок организации в стране государственной статистики и регулирует отношения, связанные со сбором, обработкой, накоплением, обобщением, хранением, а также анализом, обменом статистических данных о демографических и социально-экономических процессах в республике. С 2013 года начат процесс замены паспорта старого типа на биометрические. То есть в процессе данной процедуры все старые паспорта будут постепенно выводиться из оборота по мере завершения их срока действия. Идентификационные карты должны получить все граждане Армении с 16-летнего возраста, а паспорта можно будет получить по желанию, использоваться они будут для въезда за рубеж. В паспортах помимо анкетных данных и фотографий в чипе будут содержаться отпечатки двух указательных пальцев. В сфере регистрации рождения была упрощена регистрация найденных детей, скончавшихся в течение 4 недель со дня рождения. В случаях незарегистрированных рождений в процесс регистрации были вовлечены также органы опеки и попечительства, обязанность которой осуществляют руководители органов местного самоуправления. В нашей стране основа большинства причин отсутствия регистрации рождения детей – это низкий уровень правосознания родителей или отсутствие документа, удостоверяющего личность родителей. Проблема существует также с регистрацией рождения в домашних условиях в отдаленных деревнях. При необходимости сотрудники органов РАКС совместно с представителями органа местного самоуправления посещают деревни, производят регистрацию рождения, тем самым пытаясь решить данную проблему. В нашей стране до 2008 года взималась государственная пошлина за регистрацию рождения. Благодаря выработанному Министерству юстиции Республики Армения проекту, начиная с 2008 года, государственная пошлина не за регистрацию рождения, ни за регистрацию смерти не взимается. С 30 сентября всего года вступила в силу поправка к закону, в соответствии с которой в Министерстве юстиции начала действовать единая электронная система регистрации актов гражданского состояния, которая является частью единой обширной программы. Эта система позволяет территориальным отделам РАКС осуществлять свои полномочия только в электронном виде. В частности, на сегодняшний день регистрация рождения, заключения брака, смерти осуществляется с использованием электронной системы. Использование данной системы в первую очередь исходит из прав граждан, обращаются в органы ЗАГС, сокращая время регистрации и освобождая их от излишних бюрократий, которые обычно возникают в сфере обслуживания граждан, обеспечивая полноценность и точность информации. Уверен в том, что эта система будет способствовать упрощению работы органов РАКС, обеспечивая передачу документов между отделами, что в свою очередь снизит время осуществления полномочий, не нарушая временные сроки, установленные законодательством. Система дает возможность в онлайн-режиме передавать информацию о регистрации рождения, заключении брака, расторжении брака и смерти социальным органам, а также информацию о регистрации рождения и смерти Государственному регистру населения. Также планируется в онлайн-режиме передавать информацию службе статистики, что позволит упростить осуществление полномочий по сбору, обработке и передаче демографических информаций. Также планируется электронная передача медицинских свидетельств о смерти из медицинских учреждений, применяя международный классификатор болезней. Частью этой программы является электронная архивация уже существующих документов, количество которых свыше 12 миллионов. Объем работы электронной архивации, а также сохранение документов оригиналов со соответствующими климатическими условиями является одной из задач в данной области. Другими задачами являются сотрудничество специалистов органов РАКС со специалистами в других областях, в том числе в области здравоохранения, классификаторов, статистической службы.
Mr. Agram, you'll have to kindly...
Thank you.
Yeah, okay.
Позвольте еще раз поблагодарить вас за эту возможность, которая, уверен, будет благотворной платформой для длительного сотрудничества, что в свою очередь позволит на основании обмена передового опыта и практики развивать вышеуказанные области. Спасибо.
Thank you, Mr. Agram. From Mr. Agram's statement, it also transpires that Armenia has also made a lot of improvements, very significant one. Now, it is time for Mr. Usman from Indonesia.
Thank you.
Dr. Usman from Indonesia, okay.
Thank you, Chairman. On behalf of my delegation, Mr. Chairman, Ministers, Excellencies, distinguished delegates, ladies and gentlemen, Indonesia would like to reiterate the importance of organizing the Ministerial Conference of Civil Register and Vital Statistics at a timely juncture. In approaching 2015 for reviewing the Millennium Development Goals and in preparing the post-2015 for setting new benchmarks and targets for the coming decade. We believe that CRVS can play an important factor in ensuring the achievement of development that is inclusive, people-centered, and based upon legal and valid data. Under Indonesia's new leadership, President Joko Widodo recently initiated the Smart Card and Indonesia Health Card to provide better service to the less income families in acquiring education needs for their children and receiving basic health facilities. The initiative is part of Indonesia's universal health coverage to reach by 2019. And such program could be more effective by mainstreaming CRVS into the National Development Strategy Plan for the next 5 years ahead. Mr. Chairman, distinguished delegates, Indonesia has adopted the national legislation on civil registration since 2006 and has been revised in 2013 to ensure the effective implementation on the ground and the necessary adjustment needed across nationwide. We will continue to strengthen and implement through the provision of the related laws and regulation and through harmonizing national legislation into provincial and local policy strategies. We believe that the strengthened institution would be necessary at all levels, national, provincial, and districts, by providing proactive registration services. We are committed to continue building the infrastructure needed in health facility, human and finance resource provision, including appropriate tools of information communication technology to strengthen CRVS throughout the country. In our effort to build an electronic single identity number, the government of Indonesia has established cooperation with relevant ministries, agencies, and other related organizations. The purpose of such cooperation is to exchange and share of data between all the relevant stakeholders. In support of the final outcome of this conference on shared vision, goals, and action areas, we believe that it is complementary to the existing initiative in Indonesia. We will build the moment together with all our partners in taking up follow-up action and the necessary steps, including a comprehensive consultation across sector ministries and agencies and civil society. We underline the importance to continue efforts in supporting capacity building and to developing the necessary technical skills needed, and therefore we believe that capacity in human resources and infrastructure will be a determining factor in achieving a successful civil registration and vital statistics for all. Furthermore, Indonesia would like to seek international agency support to provide assistance for comprehensive multi-sector approach on CRVS. In concluding my remarks, let me emphasize that the outcome from the Ministerial Declaration and Regional Action Framework on Civil Registration and Vital Statistics is milestone toward to the achievement of the universal civil registration for individual. However, our task does not stop here. We shall reinforce our commitment to implement on the ground accordingly to our priorities and strategies on CRVS. Let's get everybody in the picture and achieve the betterment of our people. Thank you very much.
Thank you, Dr. Usman, for your vibrant statement. Now we shall be going to Azerbaijan, and Mr. Aga Kurim, he will be speaking, but he has requested us that he will make a verbal statement. So let us hear Mr. Aga Kurim.
Доброе утро, уважаемый господин председатель, уважаемые делегаты. Мне хотелось бы, понимая ограниченный регламент, хотелось бы буквально в 2 словах рассказать об опыте Азербайджана в этой сфере. В первую очередь хотелось бы отметить, что получивший независимость в конце прошлого века Азербайджан переживает период активного экономического роста, что направляет политику правительства страны в социальное русло. Вместе с тем, большое количество беженцев, около 1 миллиона беженцев, проживающих на территории Азербайджана, также обосабливает роль развития и важность развития CRVS. В связи с этим в течение последних лет в этой сфере были проведены серьезные реформы и были достигнуты положительные результаты. Хотел бы отметить, что регистрацию актов гражданского состояния и населения в Азербайджане осуществляют органы Министерства юстиции, в том числе и на местах. И, как и во многих странах, как мы здесь слышали, мы имели серьезные проблемы. Во-первых, проблемы, связанные с недостаточной регистрацией, то есть не получалось охватить всю страну регистрацией, а также разнились статистические показатели. Так, касательно рождения детей, данные, получаемые от Минздрава, серьезно разнились с данными Министерства юстиции, осуществляющих регистрацию. Начиная реформы, в первую очередь, серьезно было переработано законодательство, которое было построено на основе старых советских законов. Были изменены десятки нормативно-правовых актов, создана современная нормативная база. Полномочия были также делегированы для охвата сельского населения при регистрации. Полномочия также были делегированы в соответствующие органы местного управления на местах. Было уделено особое внимание внедрению информационных технологий, и еще в начале века удалось построить информационную автоматизированную систему, позволяющую осуществлять регистрацию актов гражданского состояния электронно. При этом хотелось бы отметить, что всю информацию для регистрации, вся информация для регистрации накапливается в базу данных электронов посредством взаимной интеграции с другими базами данных. Так, при регистрации рождения органы РАКС фактически самостоятельно вводят исключительно информацию об имени новорожденного. Всю остальную информацию, его медицинские данные, его информацию о его родителях и так далее, вся эта информация автоматически поступает в базу данных из других ресурсов, занимающихся ее накоплением. Был создан единый электронный государственный реестр населения, который позволил иметь полную и актуальную информацию обо всем населении страны. Вместе с тем была проделана большая работа по переводу в электронный формат всех актов гражданского состояния, зарегистрированных в течение последних 75 лет. Это заняло несколько лет, но эта работа подошла к концу, и это позволило значительно обогатить существующую в электронном формате информацию о гражданах, позволило дополнить ее исторической информацией и создать уникальную базу, отражающую также родственные связи граждан. Значительная работа была проведена в сфере взаимной интеграции различных информационных ресурсов. Так были интегрированы ресурсы Государственного реестра населения с медицинскими информационными ресурсами, с электронной базой государственной статистики, что позволило консолидировать и актуализировать всю статистическую информацию и решить вопрос разницы в различности статистических показателей. Особое внимание уделяется организации электронных услуг. И я хочу сказать, что Азербайджан достаточно далеко продвинулся в этом плане. На сегодняшний день у нас регистрацию любого акта гражданского состояния можно осуществить электронно, посредством электронной подписи, не выходя из дома. Также хотелось бы отметить, что Азербайджан уже перешел на электронные документы, удостоверяющие личность, а со следующего года умные документы будут выдаваться детям уже при регистрации их рождения. Подытоживая свое выступление, хотелось бы отметить, что Азербайджан заинтересован в более глубоком вовлечении в региональные проекты и готов оказать свою помощь в развитии системы CRVS во всем регионе. Благодарю за внимание.
Thank you, Mr. Karim. Now it is time for us to go to Afghanistan. Mr. Chair Mohammed Jada will be talking to us. Thank you.
Bismillahirrahmanirrahim. Mr. Chairman, Excellencies, ladies and gentlemen, good morning. At first, our delegation thanks from ESCAP, UNICEF, and UNFPA for this conference. Ladies and gentlemen, as you know, one of the important issues regarding to the data is civil registration and vital statistics, which is not included only births and deaths, but also cause of deaths. The coverage of the civil registration and vital statistics in Afghanistan is good, almost 45%, and we have some problem and challenges to cover all over Afghanistan. But it is the top priorities of Afghanistan to cover all Afghanistan by 2024. Afghanistan already started struggling for expanding of the coverage of CRVS by the help of national and international organizations. Afghanistan have examined an initiative which is involving religious leaders and imams for reporting of births and deaths to the registration office. because most of Afghanistan people rely on the religious leaders and elders, and they can help the system effectively. It is a starting point, and it should be improved. As you know, conflict and war destroyed all infrastructure of Afghanistan. Therefore, Afghanistan is not able to improve CRVS system independently. We still need technical and financial assistance from international community. We need regional cooperation for improvement of CRVS as well. We need technical personnel for identifying cause of these. We need training in this regard. Furthermore, advocacy is a very important issue for the improvement of the system. Afghanistan is one of the members of EMIRO region. EMIRO has already started assessment of capacity of the member countries. According to that assessment, Afghanistan has some achievement in this regard, which is close cooperation between related organizations such as Ministry of Public Health, Ministry of Interior, and Central Statistic Organization, conducting repeat and comprehensive assessment for civil registration and vital statistics, having legal frameworks such as new law of CRVS. We have started electronic passports. Central Statistics Organization is able for data storage and disseminate of CRVS data. Now we want to start, after a few days, the electronic ID card, which is useful for CRVS. These achievements allows us to improve the system in the country with the cooperation of people and international community. Thank you.
Thank you, sir. Now it is the time for Cook Islands. Mr. Horn will be talking to us.
Thank you, Mr. Chair, Excellencies, distinguished delegates, ladies and gentlemen. First, Mr. Chair, can I, on behalf of my delegation, acknowledge your appointment to such an esteemed role in the conduct of this conference. Further, I'd like to acknowledge the government of Thailand and the people of Thailand for their hospitality and warmth in welcoming us to this colorful city of Bangkok. Last but not the least, we'd like to thank and acknowledge ESCAP and our donor partners in making it possible for us, the small island development states, to be invited to this very, very important conference, so much so that I believe that we need to be congratulated that we have established a milestone in human history. The Cook Islands is committed to the importance of CRVS for governance and planning. In recognizing the multi-sectoral nature of the work, the Cook Islands has a national CRVS committee, has conducted a comprehensive assessment, and has a national improvement plan. This plan is currently being reviewed and will be updated and formalized as part of the Cook Islands National Strategy for the Development of Statistics. This work has been undertaken with support from the Pacific Vital Statistics Action Plan. Activities have been undertaken in a range of areas under the plan, and some of these key achievements will be presented in the side event on the progress in the Pacific Islands today. For the small islands of the Pacific, one of the key challenges in improving CRVS is ongoing access to technical support in specialized areas for training and capacity building, such as certification of deaths and data analysis and report writing. We also face challenges in sharing information with neighboring countries in order to obtain a complete picture of the vital events for the Cook Islands, given that many births and deaths may occur off-island. coordinated support both in country and in regional level provided through the Pacific Vital Statistics Action Plan has been very important to the Cook Islands and will continue to be critical as we move forward. The Cook Islands has been pleased to be part of the political commitments already made in the Pacific to CRVS assessment, plan, development and action through the declaration from the Pacific Ministers of Health, meetings over several years, and the Heads of Planning and Statistics meeting of last year. The Regional Action Framework provides an important means to elevate the political commitment that Pacific countries have already made and builds on this progress by committing countries to set tangible targets and goals for improvement through their national committee. The Cook Islands National CRVS Committee has discussed these goals and will set targets as part of a review of a national CRVS improvement strategy. To conclude, Mr. Chair, let me just regurgitate a saying by the first Premier of the Cook Islands who once said that no one must be left out of the tribe. Thank you.
Well said, Mr. Nandi. Now, from the Pacific community, it is Mr. Giral. He will be making a statement on behalf of the Pacific community. So the statement should be
Thank you, Mr. Chair.
a little long.
I will try to be as short as I can, sir. Chair, Excellency, delegates, the Secretariat of the Pacific Community is an intergovernmental technical organization supporting the development efforts of its 22 member countries and territory, working closely with national statistics offices and countries' wider national statistical systems. One of our core strategic objectives is to provide scaled-up support to the development of administrative databases and associated management information systems, with CRVS featuring prominently in our regional efforts. We are happy to be here to support countries in their efforts to build and sustain sustainable systems that yield quality and timely vital statistics, which alongside other core social and economic statistics are essential ingredients for evidence-informed policy development, planning, the regular monitoring of policy performance, and last but not least, to measure development outcomes and results. Vital statistics, such as those related to child and maternal health, as well as NCDs, non-communicable diseases in particular, are currently of great policy relevance and, forgive me the pun, vitally important in our part of the world. Excellencies, Pacific Island countries have made major improvements to their CRVS systems over the past 4 years, about which we'll be hearing more later on in our ministerial roundtable, since the inception of the Pacific Vital Statistics Action Plan. Mr. Chair, these achievements would not have been possible without significant political commitments at home, regionally, and from our major development partners. Nationally, through the Pacific Ministers of Health, regionally through the region's heads of statistics and planning, and the ongoing and unrelenting efforts by national registrars. All three forming a powerful and effective tripartite collaboration, which provides an essential building block for continued success and improvements. Let me conclude, Mr. Chair, by thanking our financial and technical partners in the BAC consortium of partners for their ongoing regional and bilateral country support, and commend the international community for its plans to establish a global financing facility to help ensure that no one finds themselves having left behind by 2024. Thank you very much, Mr. Chair.
Thank you. Thank you, sir. Excellencies, ladies and gentlemen, you see, because we are almost done. Before that, I wish to take from you only 5 to 6 minutes. This is, although outside the purview of the agenda, but I think it is a matter of fact. It is, since relevant to human being and humanity, and for which we are here, I think if I talk to you between 5 to 6 minutes. You will not mind. Will you mind? No. Thank you. So you see, I start like that.